Hello to our wonderful viewers and audience from around the world. This is Dr. Rasha Kamian. I am here with another amazing Podinar with the amazing Dr. Shervin Molayem. Dr. Molayem, thank you so much for joining us today. We have so many people from around the world who have tuned in to hear your important message. I know you have some amazing news to share with us. How are you doing today?
I'm doing great. Thanks for having me on here.
Oh, it's absolutely our pleasure. Thank you so much for taking time out of your Saturday to join us. For those who are not familiar with Dr. Molayem, I've had the pleasure of knowing him for over 20 years, and I've really watched his career blossom. Uh, we both graduated from UCLA. You got your dental degree at UCLA, and then I believe you were also at USC School of Dentistry when I was there. That's where you got your perio degree. And Dr. Molayem has been actively involved in dental research. In fact, he was the founder of both the UCLA and USC Journals of Dental Research, which have been going strong now for over 13 years. He's published in the field of dental implants, periodontics. He was a co-founder of Synergy Specialists, the largest agency for traveling dental specialists in the United States. He has been practicing in private practice here as a periodontist in Southern California for more than 10 years now. And he's also been conducting research and has published now the most comprehensive connection to date between the mouth and COVID-19 in the Journal of California Dental Association. And this research is going to completely revolutionize the way we are looking at the connection between the mouth and the body in relation to COVID-19. So I'm so excited about the talk, about talking to you today. And really, first, I want the audience to get to know you a little bit better. Tell us a little bit about what you've been up to for the last 10 years and your experiences and how this kind of led up to your doing this research and publishing on this research in the California Dental Association. I think soon this is going to be picked up by major organizations around the world.
Yeah, so a lot going on that you mentioned. But first, a little bit about myself. With co-founder of Synergy. So basically, that's a specialty group where we have endodontists, periodontists, oral surgeons, and offices will reach out and basically we match them up with one of our specialists, and they go in on a once or twice a month basis, and we'll produce and do the services. So I've had the role of a mentorship role for a lot of graduating specialists, especially periodontists, since I'm a periodontist. It's been a great learning experience, and I've also got involved in teledentistry with Dentulu and yourself, which has been amazing, and we believe that's the future. More recently, with the pandemic, I feel dentistry has completely changed, and I want to explain. This presentation will be on the mouth COVID connection. It's similar to kind of like the perio systemic connection or perio body connection. But basically, I feel that, and I believe that as dentists, we have a role right now that we need to step up, and we've always been the dentist and we're not the doctor, and people, that kind of joke has always been around, but this is our time to become the doctor, and I'm going to go into why and how in my presentation. It's really exciting. There's a lot of this is getting out. We just published our article, myself and my co-author. She's a PhD periodontist from South Africa, and our work basically will show that there's a very strong link. And it's yesterday, for example, I was in communications with the president of the American Dental Association, and the president of the California Dental Association has seen this, read the research, and the former president of the American Academy of Periodontology. So it's definitely, I'm so excited, and I think definitely will make a difference.
Yeah, I mean, stepping back a little bit. First of all, it's been just amazing just watching your career from the beginning. I remember you when barely any general dentists were even thinking about implants. You were already training periodontists, GPs. I'm talking about maybe 10 years ago about implantology, about bone grafting, GBR, and I think working in so many different settings, you've gotten to see really. The different ways dentistry is practiced and really been actively promoting dentistry and helping dentists increase their knowledge. And really that's what this platform is all about.
Yes.
We can do one of two things. We can complain or we can figure out solutions and we can figure out how to get past this. And this is just one of many hurdles, right? Dentists
Yeah.
around the world have had many different hurdles from people now recognizing the importance of dentistry in the general health. We talk about how our oral health is connected to our systemic health. I mean, your research now, I mean, we already knew this. It's a predisposing factor to dementia, Alzheimer's, atherosclerosis. So it's really interesting now to see actual published information with such a well-respected group such as yours on this connection. So, yeah,
Yeah.
I think. What do you think this is going to do? I think so many patients have been avoiding the dental office. It sounds like that's exactly where they need to be in many cases
Yeah.
for prevention.
Yeah. So I practice almost every day still. I see a lot of patients, and so I have a unique sense, and I travel to different cities, so I have a good lens on what's going on. I've seen people that haven't gotten cleanings in a while. We're talking, when was your last cleaning? Last year. Then you delve in a little bit more, and you find out it was actually 2 years ago. And not too many people have gone a cleaning in 2020 because of the pandemic. Maybe there was January and half of February, maybe, so um, mouths are dirty, gums are bleeding more, inflammation is more right now in people's bodies. So this all has to do with what's going on. And I want to say this is actually this is the second webinar I'm doing on this topic, so it's very fresh. A lot of people haven't heard this information before, so I think it's very important, very timely. We are still in the peak of the pandemic, in the second wave. So we as dentists, we have an opportunity to affect and change and save lives with what we do.
Yeah, the majority of the stuff that's going on is in the upper respiratory system. We're right in the front line, literally, and I think it's not only an opportunity but also an obligation. I was dumbfounded at some of these restrictions that they were placing on dental offices at the beginning, and the limitations that we had as dentists practicing. And I feel like we play such an important. We can, and we should play such an important role. And we should be encouraging our patients to come back. I think we saw so much misinformation about staying away from dental offices.
Yeah.
I think, and I'm hoping this research empowers not only the dental offices but the patients to feel more secure about coming in for dental work, but also how important it is and how this could really affect people's health and how it'll affect their recovery.
Yeah. So I want to go back to a point that you made. So throughout my career, you're right, I have been kind of a defender of dentistry in the sense of when Instagram first started, I was one of the early ones that had, I got the handle dental surgeon. Was posting a lot, and really, our generation is the generation where, just like Facebook, just like a lot of, everything is an open source. We are all about, we're not hiding anything. Information is free to flow out and come in. So that's what I've seen and I believe. And I believe through teaching, through educating, through communicating with other dentists, sharing tips, I benefit as well. So it's a two-way street. Everyone wins. And, people through the social media right now, they're learning how to do wisdom teeth. They're feeling comfortable placing implants. Maybe they saw someone 5 years ago who never placed an implant, and they saw all of a sudden he's doing sinus lifts now. It motivates them and inspires them, and they're following their page and they're following their cases. So it's an amazing world we're living in right now.
Yeah, I know you've been actively involved in research. You set up those two, the research magazines at UCLA and at USC, and they've been thriving since you first established them about 13 years ago. But I think really interesting is this new freedom of sharing information. We see it in different capacities, and I think doctors being able to, whether they're in these closed groups or open groups. I mean, we have right now, just look at the participation from Morocco, from Germany, from England, London, Canada. We have people from all over the world hearing your message, and this is going to be really big, guys. The California Dental Association has already picked this up. The American Dental Association is going to be releasing more information on this. And now we can comfortably say that dentists are going to be playing an active role in battling this pandemic, and that we have a huge role to play, how important it's going to be. And they're finding out, just like we've mentioned to our patients for years, is that the mouth is directly connected with the rest of the body, and that it has implications on other diseases and how we recover from them.
Yeah. I want to just explain give a little tip on something that I do and use in my practice. How much time do we have until we start?
Yeah, go ahead. No, we have time. We have another 10 minutes before we start the actual presentation.
So just to make this a little constructive, I want to go through what I say to a patient. Let's take this to what you're going to do when this weekend is over on Monday morning. Mm-hmm. Let's set the stage for the presentation that's about to come. And also, let's go over what to say to the patient. Because if you hear what I'm going to say, and it goes through one ear and out the other kind of thing, and you don't know how to explain it to the patient, then it defeats our purpose. So when we're talking to a patient, we want to first put ourselves in their shoes. They don't know that, for example, a tooth is held by a jawbone, some of them. So when I'm talking about you have bone loss, some people really don't get it. So you have to set the stage. So let's talk about how to explain periodontal disease. So first, I'll say our teeth are held in our mouths by our jawbone, and it's held in their place. And when we get bacteria, when we get plaque, and again, people don't know what plaque is. Plaque is the white thing that when you wake up in the morning and you scrape your teeth and you see some white stuff, that's the plaque. And that has a lot of bacteria in there. That bacteria then leaks underneath. Remember, these are microscopic bacteria. They leak underneath, and depending on how deep it goes, it can get into the bone. And the bone is, again, what's holding the teeth. And that bone, with time, can go lower, can get holes in there, and ultimately it can cause the tooth to get loose and it's the number one cause of tooth extraction or loss of tooth. So now they kind of understand a little bit more. And so now you want to explain how this affects their body. Let's talk about periodontal disease. How does it affect your body? Well, in one surface of a dirty tooth, there's over 100 million bacteria. These are different species. They have a whole community. And these bacteria, when they leak toxins, remember, they have weapons. They leak these weapons, the toxins. They seep through, they get into our bone. And I'll show on an x-ray. Do you see, an x-ray is not completely white. It's porous. The bone is white and there's little holes. I'll say, do you see these little holes in there? These holes are blood vessels in your bone, and you have a lot of blood vessels in your gums. Now, this is how the toxins and the bacteria get into your bloodstream. Once it gets into your bloodstream, all it takes is 1 minute for it to reach the bottom of your foot. When our heart beats 60 beats per minute, that's, blood flowing and pumping. 1 minute it takes to get to our foot. That's why when they do an IV, within 30 seconds, you see their eyes are starting to get glazed. That's because it's traveling to the brain already in 30 seconds or so. So now they kind of understand, whoa, 1 minute, that's a lot of bacteria. This could affect, again, loss of tooth. This is bacteria in the infection in their body. It can cause bad breath. And you have to see what his, sometimes you'll say something and look at their body language. You might say it can kill you, it can do this, and it causes bad breath. They go, oh, bad breath. Okay, now I got to do something about it. So for everyone, it's something different. Or you're saying, it leads to heart attacks, strokes, cancer. You could lose, possibly the tooth, and you can't, chew as well. The people love their food. They want to chew. So you have to also find out what motivates people.
The conversation has to be dynamic. So when you say it might kill you, they don't react. But if you say it might make you have bad breath, all of a sudden you get their attention, right? The way I really love the discussion about language and how we talk to our patients and how we speak to our patients. When I have my implant courses, I tell them, I said, don't tell your patients you're putting screws in their mouth. Nobody likes the idea of putting screws in their mouth. And if you're saying words like your tooth is hopeless, or your virgin tooth, or some of the words that we use are just maybe to us it's normal, but to patients it isn't. So I agree. I think the language is very important. The way I describe it is I tell the patients, I said, when you feel chest pain, when a lot of people have chest pain, angina, there's a medication that they give to them. Do you know what that medication is? And then we start talking about it. I said, well, do you know where they put this medication? They want this medication to get to the heart as quickly as possible. And we talk about it, not being injected, not a pill to swallow, but they put it under your tongue. And I said, this is the fastest way to your heart. They get this medication, it dissolves, and it goes straight into your blood system, and it ends up in your heart. And that's a direct connection to your heart. So imagine all the bacteria that's constantly seeping into your heart. And imagine all the bacteria you're breathing in, going straight into your lungs, and the little air droplets, or swallowing it and going to your stomach. So then it starts visualizing. But I agree, you have to keep it dynamic, and you have to read them and see their reaction.
Yeah, and sometimes, great points. Sometimes we're also, as dentists, we're also scared to deliver the type of news to them. Like we feel like we're hurting them, hurting their feelings. You're gonna do more harm not telling them, not being passionately excited about getting infection out of their body, because if they feel that you're scared to deliver this news and you're scared to explain it to them, then they are going to be timid to want to do it. So your actual confidence and description and explanation of all of this is what will make them do it. Now, and eventually help them. Now, they have to remember, now there's some people that only do things if they're in pain. So that's why they get a root canal right away, that cavity that's deep or whatnot. But only 6% of gum infections and gum disease cause pain. So 94% of these things are silent. People don't know. They could have a loose tooth that's really infected and have no idea.
Mm-hmm.
So you have to also set the stage. So I have a picture of the different stages of gum disease and how the x-ray looks like. You have to have some good tools and to be like, look, this is your x-ray, and this is the one that is the most severe. Don't they look alike? And then they'll do a couple double takes and be like, yeah, that's like, look, there's no more picture after this. Like, this is the worst thing you could have in your mouth. The company didn't make another picture because this is, very advanced. It's an 8mm pocket. You have a crack underneath there. So they have to kind of see it to believe it. And sometimes they also have to see it in their mouth. because I give my patients a mirror and then I show them with a probe. If they don't see it, they don't own it.
Yeah.
And
Yeah.
if they don't own it, if they don't know it's them, then they're not going to do anything. If it's just like, oh, you're showing me on, you're telling me, okay, you're showing me, it's you're a lawyer building a case to try to help your client, type of thing. So
it hurts me. It hurts me when I see patients. When I see either some of my associates or other doctors, they go straight to the X-rays. They barely say hello to the patient. Maybe hello, and then they start reading out 12 DO, 15 MO, and they just start talking to their assistants. And then they allow they let the assistants do most of the talking. I think the first thing that should be performed is establishing rapport with the patient. I'll tell you real quickly in a couple of minutes what I do that works really well in my office. First of all, I learned this from Dr. Jin Kim, by the way, another great periodontist, and I've been teaching with him for almost a decade now. He actually has a microscope in his office, and he actually takes a sample and puts it on a screen. He literally projects the microbes and bacteria moving on the screen and shows the patients the bacteria. So it's visual. I've been advocating patient education videos for the last 10 years, and I let them watch videos and let someone else validate it, and I just confirm what they just saw on a professional video, right?
Yeah.
So intraoral cameras. Dentulu, we have the world's first intraoral cameras that we actually give to patients, and we send it home with the patients, a consumer intraoral camera. Because, in every single operatory in my office, I have the biggest television I could possibly fit on the wall, and I put the camera in their mouth, and I let them see it. I mean, I can describe to you what plaque looks like, but why don't you just look at it, on the back of your central incisor? So I think that goes a long way. And then another thing I do is I just go straight to Google, right? Everyone trusts Google. I go to Google, I say advanced periodontal disease or advanced bruxism, and I press the images, and I literally just show them to them, and I say, you know what, this is what I want you to go home and go do some more research. None of these are my cases. This is just information out there. And so, yeah, you have to convey that information for them. And the last thing I want to say is, if the dentist, and this is why this is important to us today, and this is why I want you to share your message. If the dentists don't believe in it themselves, if the dentists don't feel like they're true doctors, if the dentists don't believe how important this is to the general health, then it's not something they're going to really convey really well to the patients. I think and evidence and research like the ones that you guys are publishing is just going to play a huge role in educating the dentists to then educate their patients.
Yeah, like you said earlier, it's been linked to atherosclerosis, a 2 times higher chance of heart attacks and strokes. So these statistics should be flowing off of the tongues of every dentist's mouth.
Right. I agree.
They should know that there's a 2 times higher chance of a stroke with people that have
atherosclerosis, dementia, Alzheimer's, prostate gland enlargement, premature births.
Certain cancers have been linked to it. It's actually the worst type of cancer. One of them, pancreatic cancer, has been linked to it. When people get cancers, it's the more aggressive form that has been linked to it. I can go on and on. The whole immune system is connected.
So, Doc, I wanna give you enough time to go through your presentation.
Right.
So everyone around the world, all our viewers, we are now going to get some incredible research. And again, Dr. Molayem is, we've had the pleasure of being one of the first platforms to share this information around the world with everyone else, from India to Germany to France, London. And this is going to be all over the news. It's going to be picked up by all the news outlets, and we are now going to see what a crucial play dentists can play within, the prevention of the exacerbation of this pandemic, how the oral health relates to the general health in relation to COVID, and some of the things that we can do, maybe in the testing or treatment that can actually help address, the exacerbation of COVID-19 in our patients. So with that, Dr. Molayem, I'm so excited to hear this. Maybe you can share your screen and we can begin the presentation.
All right. So I have my presentation up. Are you guys able to see it?
Yes. It shows it's a dark screen right now.
Okay. Let me try that again.
There you go. You're on.
You got it?
Yes, sir. You got it.
All right. Perfect. So The title of the paper that we literally just got it's getting published in the Journal of the California Dental Association in their October issue. There's going to be a specific issue just on COVID, COVID and dentistry, and this is going to be one of their featured articles. And it's on the mouth-COVID connection, IL-6 levels in periodontal disease, potential role in COVID-19 related respiratory complications. And this is my co-author. She's an amazing woman in South Africa. She's also a periodontist, a PhD, and it was a pleasure working with her on this paper. They made it available digitally just about a day or two ago. So this is very fresh, and only until now I've been able to actually share it. So this is the kind of the overall of how the connection is, and I'm going to be getting into each of these. But basically, there's different pathways where the mouth links to COVID and our lungs, basically, and leads to respiratory complications. So we will go over that, and we'll introduce the topic. We'll talk about IL-6 in relation to period. It's an inflammatory soluble protein. It's an inflammatory protein. So not all proteins in the body are good. There's a lot of bad proteins. C-reactive proteins, or CRP, is also a bad one. But IL-6, there's IL-1, 2, there's all these ILs. IL-6 is a very bad one, and we'll get into that. We're going to talk about respiratory diseases and periodontitis, that link. IL-6 viral infections and COVID-19. We'll talk about biological mechanisms of how this process happens. We'll talk about perio treatment in COVID-19. We'll talk about IL-6 genetic testing, and I'm going to go over some solutions and some action items and things that you could tell your patients to do to make this things better. So basically, the clinical importance of my review article lies in the awareness that dental professionals can have a major impact on the COVID-19 pandemic through promotion of periodontal health, considering the benefits of prevention and treatment of periodontal disease on overall health, including prevention of complications resulting from the coronavirus disease. So this COVID, let's start kind of backwards. What's happening with patients? What are we seeing? Well, basically 80% of people who get it don't have symptoms, really. They're very mild cold symptoms, perhaps. No major complications. 20% get severe symptoms, like respiratory problems. And of those 20%, 5% of them are life-threatening, like require intensive care unit or ventilation, intubation, and having a machine breathe for the patient. And what leads to this downward spiral has been linked to IL-6. This is when you hear about the cytokine storm. IL-6 is a cytokine. This is what's storming. This is what's going kind of elevating and getting out of control. And there is a study that showed that we're going to talk about. So how does COVID relate to dentistry? Well, dental professionals have suffered the impact of COVID-19 in profound ways, which is directly related to the importance of the oral cavity as a transmission route. So the potential for salivary glands to function as reservoirs for COVID-19, the infectivity of the saliva, and occupational health issues due to the nature of dental treatments. With the reopening of the dental practices during this pandemic, dental professionals are really faced with challenges that range from strict infection control measures to a decrease in the number of patients willing to undergo treatments. And we've all experienced this. Now, there's going to be a shift in a more general health. And this is what I'm trying to explain to everyone, that we as dentists, we're going to have to shift. And we have to look at now, not just at the teeth, we have to talk about overall health with our patients. Because infections in the mouth, gum disease, periapical radiolucencies, retained root tips, root canals gone bad, cracks, all of these contribute to systemic inflammation and release of cytokines. And by dentists focusing more on this aspect, we can become part of the solution for our patients. They will see it, they will feel it as you explain it to them, and this is how perio or the mouth connection works, basically. Not too many people are talking about this. And the people listening to this lecture, I feel, are going to really benefit. And patients are really, these days, they're not seeing their doctors too much. If they're not sick, they're staying out of their medical doctor's office because they don't want to be in an office where maybe someone else might have a sickness. So people are not seeing their doctors as much right now. So that means there's a void. Again, I believe there's a void in healthcare, because if people aren't really talking to a doctor, then they may feel kind of lost. All they're relying on at the end of the day then is just Google, the news, and we know right now every day something changes. Things are different. You can't really rely on the news too much. So people are staying home. They're staying kind of out of the streets more, especially the elderly. And the elderly are a huge population because of the, especially in the U.S., United States, we have the baby boom population. So these are also the people that have the most gum disease as well. So we have to protect this group of people. Now, the impact of the connection between periodontal treatment and IL-6 levels, respiratory conditions, and COVID can be powerful, considering the high prevalence of periodontal disease in adults, the transmission rate of SARS-CoV-2, the limited access to periodontal treatment during the pandemic, and the shortage of healthcare resources related to hospitalized COVID-19 patients that require mechanical ventilation. 47% roughly of patients in America, at least, they have some sort of mild or moderate or severe periodontitis. So not gingivitis, but periodontitis, which means it's when periodontitis is when it's happening in the bone, the problems in the bone, the infections in the bone. The more advanced form of periodontal disease. And in adults that are 65 or older, the prevalence rates increase all the way up to 70%. So this is a huge issue. And the dental groups, when you see on social media, you go on Facebook. There was one the group that I'm a part of. It's called Coronavirus and Dentistry. Someone asked the question, are you guys seeing a shortage of hygienists in your state? And literally everyone was like, yes, in my state too, hygienists have been a little bit scared away by the media and everyone that, they have their own Facebook groups. They're talking, we don't have enough PPE, we need more time between patients. I need a Cavatron and I can't use it at this time, so I can't, work. So we've seen, and then also you have the part-time hygienists that were only 1 or 2 times a week. There were moms part-time, caretakers that had, maybe another job. Those people are like, well, it's not worth it for me to come back 1 or 2 days a week because of, the chance of maybe dying. So why would I? So there is a shortage of hygienists, and it's noteworthy that in at least the United States from what we've seen. So this is a chart of kind of where we're at right now as far as in the United States. So I know we have people from all over the world, but in the United States, the number of cases are rising. They are doing more testing, and this is the number of people hospitalized. So we're seeing we have a second wave. I know in some countries they are able to get it under control. You have Sweden, who has been of late, has brought down the numbers. We have a lot of other countries. If you want in your comments, if you have a country that's doing well, you can write it. But we have some, as such a big country with 350 million people, we are having some trouble, and for such an advanced country, this shouldn't happen. So I'm trying to do my part as much as I can to try to help with this. These are the deaths, and when you look at a graph like this, you want to look and see this line that you see. That's the 7-day average line. That's a very important line because that shows a trend. Without this line, you can't really see a trend too much. So this is as of maybe a week or so ago. We started to see some more deaths in the United States. But overall, it's not, I feel that we got this number, this peak has gone down because of the treatments have gotten better. So doctors are getting smarter, seeing what works in other countries, sharing information. There's WhatsApp groups of doctors. There's different medias, different avenues where doctors are communicating and collaborating to try to beat this. And it's a great thing to see the world working together right now. So let's talk about IL-6 in relation to periodontitis. Now, periodontitis, remember, is an inflammatory process. It results in the destruction of the periodontium, triggered by mediators such as the ones you see here. And again, they're soluble proteins, and they're signals. They recruit cells. They think of it like these cells, the PMN, which is neutrophils, the macrophages, the B cells, the T cells. All of these cells, endothelial cells, epithelial cells, all of these cells can release IL-6. There's very few of these cytokines that literally almost all of them are releasing IL-6 or have the ability to. So when our body gets bacteria in it, and we have these, first line of defense, you have the neutrophils, and then you have the other cells coming later. But each of these that come in, they can release IL-6 and other cytokines. And it's kind of like they're sounding the alarm. There's a war, there's like a first shot, and someone's ringing the bell and trying to get the troops ready for war and battle. So what happens? One soldier comes and hears the bell, yells it to the other person yells, the whole body. That's why it's called a cascade of a communication, a cascade. One leads to another. And it's a trigger. So IL-6 is also involved in host response to infection, injury. It also is involved with bone resorption, which we'll talk about. Now, there is different types of IL-6 or different polymorphisms, genetic polymorphisms. I don't want to get into it too much, but just know that there's different types of them depending on the nucleotide sequence. These two are the most common. You have the 174 and the 572. They're the most common. What I want you guys to know is this. Everyone has an IL-6 gene. This gene has two alleles. These alleles are either a G or a C. Now G is not good, C is good. So if you're GG, it means you're high risk. If you're GC, you're medium risk, and if you're CC, you're protected, you're at a low risk. And so I personally, I got mine tested. Once I learned this, I said, so there's a salivary test, you spit. When I got mine tested, I won't say what it was, but it wasn't a high, thank God. But you know, if it is, even if you have a high, at least then you know that how to behave, and you know, are you going to be the mask wearer, you know, where you have the N95 when you're hanging outside, or you know, it's good to know what your risk is. Then you can make better decisions about your life and your survival. So that's a really important. We're going to touch on that again. Now, the IL-6, there's a high expression of IL-6 that has been reported in inflamed gingival tissue. So right in the gum, upon, you know, the bacteria in there, and it's in response to something called LPS. LPS is a polysaccharide. It's secreted by the bacteria when it comes in. It's a weapon. Think of Spider-Man has like a web. You have something going in, and they're releasing something, and that breaks down the gum and bone tissue, the LPS, and so in response to that, we have a higher IL-6. Plus, there's a role IL-6 plays on periodontal bone destruction through osteoclastogenesis. So it could break down bone, and it could stop the formation of bone as well. Okay, so literally it can do both of these things, and it also upregulates and stimulates production of something else. It's another weapon, MMP. MMP degrades collagen. So think of it like these bacteria come in. Again, these are periodontal pathogens that enter. They have weapons. One of them is LPS, one of them is MMP, and they're going in. One of them breaks down bone. One of them can go break down collagen and activate, as a result, your cells to go and release IL-6, and then this IL-6 enters into the bloodstream. So we see 4 places where IL-6 gets released. We see it in the gingival crevicular fluid, so the little fluid, it's a very small amount of fluid that's inside the sulcus of the gums. We see it in saliva. We see it in actual gingiva, the actual gingival tissue, we see it. And most importantly, we see it in serum, or, you know, serum is a part of the blood. You can kind of, for all intents and purposes, call it blood, but its serum is the part of the blood that doesn't clot. Okay, it doesn't have fibrinogen. Now, when serum levels of these patients, of IL-6 patients, let's say, they've been reported to be significantly higher for patients with gum disease, and it's usually in a healthy situation. You know, the value could range from 0.25 to 40. That's where it is. Actually, sorry, that's what it's going to be in the range in periodontal periodontitis patients. So 0.25. Remember these numbers. We're going to come back to these numbers. 0.25 to 41 picograms per milliliter. And there's been reports in the study, periodontitis patients in their serum have up to 216 picograms per milliliter. Okay? Now, you're going to see in a moment, we're going to tie it in, because when you get above 80 is when people are getting on a ventilator. Okay, so we're going to talk about it in a moment, but I just want to give you a preview. So again, these are the literature that cites this. I mean, there's a lot of literature to show IL-6's role in periodontitis. So there is the following findings are basically why we see such a strong evidence. So genetic studies confirm IL-6 polymorphisms can be increased susceptibility to periodontitis. Genetic studies confirm that IL-6 polymorphisms can be, in vitro studies also confirm IL-6 can be produced by a variety of cells in periodontium, being a mediator for inflammation and a host response and bone destruction. We have, again, this is just a review of what we just talked about. We see it in periodontal tissues. We see it in the gingival curvicular fluid. We see it in saliva of potential of periodontitis patients. And we also, again, this is not studied as much, but they find IL-6, high IL-6 levels also in pulpitis and in periapical lesions. So that is why when people, that you're hearing this new holistic approach to dentistry, when they say, you know, when root canals go bad, when there's a, you know, the root canal has already a periapical lesion, you know, it may not be the best to try to retreat it. You know, it might be more predictable to go with an implant. You know, again, that's debatable. I'm not making a case for one or the other, but there's more and more research coming out now on pulpitis and periapical lesions, showing that there is a high IL-6 level. And a lot of other oral conditions contribute to systemic inflammation, and can lead to this increased cytokine storm. So let's talk about respiratory disease in particular and COVID. So COPD, or chronic obstructive pulmonary disease, is very prevalent. It's basically we see higher prevalence with COPD patients and in patients with periodontitis. So I don't want to get into too much detail, but just know people that have more COPD have more periodontitis. People that have pneumonia as well, they have there's a significant association with pneumonia and poor oral hygiene. With comprehensive dental care, they see a dramatic decrease on pneumonia. Isn't that interesting? And again, the take-home point here is in hospitalized patients, intense dental therapy can help prevent respiratory complications. So this is, and keep in mind, COVID is a respiratory disease. That's where the ACE receptors are. It starts in the nose, goes deep in the nose, it goes down the throat, because these are where the ACE receptors are. And the virus can bind on these receptors, and then also down in the lungs. So it ends up in the lungs and our inability to breathe. So this also, there's a relationship, a significant association between periodontitis and lung function in general. And people who have a decreased lung function, airflow limitation, they have a tendency to have more missing teeth. With periodontal therapy, again, this has nothing, the three things I just mentioned have nothing to do with COVID. I'm just saying in general. But when you just clean people's teeth that have lung problems, they get improved lung function. Wow. Why is no one talking about this right now? So, and also asthma has been. But also asthma, some people, they use a lot of inhalers, they do mouth breathing, they may have lower saliva, so there's some confounding factors that could be playing here. So this is not as strong as an association as the other ones. Sorry, this is the slide over here. So this is not as much as a factor as the other ones, because of the dry mouth possibly. So just a summary here, we have periodontitis, we talked about COPD, lung function, pneumonia, helping and doing cleanings and plaque control can improve the lungs, the lung function, and when people are hospitalized, it improves. So right now, people are hospitalized due to poor lung function. Perhaps, if dentistry and medicine were a little bit more connected rather than separated, the doctors go to medical school, the dentists go to dental school. So, doctors don't check the gums, which is absurd to me. I still don't understand why medical doctors, they don't have a probe when they should. That's going to be probably one of my missions in life, is to be part of the solution to getting all doctors, the hospitals. How much does a probe cost? Not much. Put a probe, show them a quick video on how to measure, just stick it in, see if it bleeds, see how deep it goes, refer to the dentist. End of story. That will change healthcare, I believe. And I'm talking about just some of it, but heart health and lung. Those are two of the most common causes why people die. Heart and lungs. Your heart stops pumping, or there's a clot somewhere, or stop breathing. That's how most deaths, along with maybe cancer and car accidents, that's where the bulk of it is. So that could be improved. So now let's talk about IL-6 viral infections and COVID-19. So you can see, again, this goes back to right now we're seeing our mortality rates aren't as bad as we thought. We're seeing, as far as the deaths are closer to, 0.3% to 1% range. So it's not as bad, at least in the United States, with the deaths. But let's talk about now. So these are the ACE receptors that I talked about, and they're present in many cells and tissues, including they're in the lungs, they're in the heart, they're in blood vessels, kidneys, liver. So they're in a lot of parts of the body too. So they're not just in the lungs. You can see they're not just in the lungs. You can see that. So this is, I want to talk about this article. This is one of the most important articles you will have seen in 2020. More important than mine. Because this is what sparked my article. This is what got me moving. This is what motivated me. And I spoke with the author, Dr. Tobias Harold. He's from Germany. Now, basically, what he shows is that of the people, and this is a very simple study, very easy. The people in the hospital that came in, he drew their blood when they come into the hospital, and then draws their blood when they're in bad shape, when they can't breathe, or right before. So at different times, he says, him and his team, they say, let's see what's going on in the body. Let's see where all the levels are, all the immune function cells. Let's see what's going on. Let's see if we see any patterns or any trends. So he finds that there is a strong association between IL-6 and the need for being on a ventilator. And it was almost black and white, as you can see. See that dotted line that says 80? He noticed that when people's IL-6 went above 80, people went on a ventilator. It was almost every time. Now you see the two outlier dots in science, people disregard that. So it's almost like black and white, but we'll even leave those dots there and count them in. That is what we call in science, in the article, look at the word. The title of the article is Elevated Levels of IL-6 and CRP Predict. Not associated, not cause, not correlation. It's a predictor. And it's a 22 times higher chance. And I don't know if you guys, what your math level is, but 22 times means there's a over 2,000 higher chance of respiratory complications. And by respiratory complications, I mean a machine breathing for you. And again, people don't know about that too much. At least the patients I talk to don't know too much about it. So there is a drug right now that's being looked at, which is very, it makes sense. So if IL-6 is the main issue, then why don't we find a drug that is an IL-6 antagonist? That already exists. there is a drug. It's an arthritis medication. It's called Tosilizumab, and there's a lot of studies happening on it. This was, I think, one of the earlier ones, but now there's people looking at this, and there's, when people get hospitalized, they're giving them this, and they're showing a 90.5% of the patients recovered after 13 and a half days. That's pretty high. Again, not 100%, but 90.5% of patients by giving them an IL-6 receptor antagonist. All right, that's amazing. So again, this talk is a good. I'm going to give a lot of positive news. Science is amazing. They're coming up with great things. It's not, a lot of it is not making it into the news, but I see a light at the end of the tunnel, is what I'm basically saying. Also, again, since this is an inflammatory disease, COVID is an COVID death, or what we call severe COVID, is an inflammatory disease. It's an inflammatory process. So we want to decrease inflammation. That's our goal. If someone asks you, Doc, what do I do? Quickly, you say you want to decrease inflammation. How do you decrease inflammation? With anti-inflammatories. What's a known anti-inflammatory? Steroids. So we can give steroids in studies where people are hospitalized and in very bad shape. We reduce deaths by 1/3 of those people that are receiving ventilation, and 1/5 decrease those receiving oxygen. What do I do with my patients? I tell them this stuff. I create a value. When they see me, they think they're just coming for me to see their teeth. I get into, I attack the big elephant in the room. I point it out. I say, how are you doing with COVID? I talk about COVID with every patient. I talk about what vitamins they need to be taking. I talk about how to survive, how to live, what they need to be doing. They love it. They say, Doc, could you write that down for me? Thank you so much. You're amazing. All of a sudden, more important in their eyes at that moment of their life when they need it the most than their medical doctor. Their medical doctor didn't give them that advice. I did. So you better believe that's going to be a practice booster. If you're part of the process of enlightening someone of, hey, do you know why people are dying of COVID? I asked that to my patients. I said, do you know why people actually die? They're like, no. I'm like, it's IL-6 and this CRP and a lot of these inflammatory, I say, do you know what a cytokine is? No. No one knows what a cytokine is. Do you know what cytokine storm is? No. Did you know COVID, people die of inflammation? No. Nobody knows this. It's interesting that nobody knows this because it's so important. And this is very interesting. So there is a doctor in somewhere in Texas that's been talking about this, and he basically is talking about how there's a lot of studies now being done on this. But basically, again, if it's an inflammatory process, okay, steroids, when you take steroid pills, also steroids have the a lowering immune system effect too. It lowers the immune system, but it decreases inflammation, which is very good right now. It lowers IL-6 levels. So, but if you're, let's say, I'm going to give you the analogy. If you're a firefighter and you want to put out a fire, you don't want to wait later on when the fire is there, it jumped over the freeway and it's on that, and because then it's very hard to put out this fire. So you want to get it locally. And again, where does this disease, where does COVID start? It starts in the nose and in the mouth. So why not, let's inhale steroids, like asthma medication, budesonide or cyclosinide. These are inhalable with a nebulizer. You put the nebulizer here, that's the little mask that people breathe in, and they breathe in a steroid, and it's like a firefighter right away They see a fire, going to the source, putting it out. Never even goes anywhere. So this is looking very promising. Data is being done, but there's some good news coming out of this. I would Google this, learn more about it, because they're actually doing this in a couple of countries, and I think it's like Taiwan or Japan. A couple of the countries that are doing really well are actually doing this, and it's working really well. I don't have this in my presentation. The next thing I want to talk about, I just want to talk about the hydroxychloroquine. That is a hot topic, at least in the United States, because it's pretty much in the United States, it's frowned upon if people use it, if people suggest to use it, if people prescribe it. It has been shown, in the literature. I'm not talking about. We have to separate politics and science, and I think that when we connect the two is when we get. It's just horrible. It's horrible for humanity. It's a bad precedent. We as doctors, we should not even pay attention to what's going on politically, because our job is to do no harm, and we need to talk about the science, and I really believe that the truth will eventually win. The truth will eventually get out with time. That's been my theory always. So hydroxychloroquine, actually, there was a study. Again, the best studies are simple studies, not when they get too cute and complicated. They just took people, they gave one group hydroxychloroquine, one group they didn't. They checked their IL-6 levels. Easy, beautiful study. Showed a significant lowering of IL-6 levels in people who take hydroxychloroquine. So, is it safe? It's been around for many years. In my opinion, again, this is just my opinion on hydroxychloroquine. Again, I'm not a medical doctor, but I just, again, I think if I were to get it, I would use it. I would use the hydroxychloroquine. Maybe I wouldn't take as high as a dose. Maybe I would take it maybe less often. But again, it's prescribed over the counter in many countries, and it's been working for many years, and has been proven for many years. Okay, so this is kind of just a summary of everything, but I'm going to get into some more summaries. Now, biologic mechanisms. And if anyone has any questions, they can save it for the end. You could write it down on the side or save it for the end, and then we can answer them. But biologic mechanisms. So this is kind of how the disease happens locally. We have the inflammatory mediators locally. We get activation of the immune cells coming in, releasing the IL-6 locally. Also, we get straight bacteria going into our bloodstream, or bacteremia. Okay, that also upregulates inflammatory mediators throughout the body, throughout all of our blood vessels. When bacteria flows through it, it also further activates more IL-6 later on. So you have multiple opportunities, so to speak, for this to happen from the gums. Let's talk about that. Now, how is it getting into our body? We can, as actually Dr. Kamin spoke about earlier, you can aspirate these bacteria through just inhaling into our lungs, and they could adhere to our lung epithelium, and the aspiration of secretions from the oral pharynx into the upper and lower airways. They can adhere to the respiratory epithelium and initiate or exacerbate infection indirectly through the release of that LPS, or that weapon that the bacteria have. We have enzymes that are produced in periodontal disease, can alter the surface of the respiratory epithelium. So you have also this direct link of going into the lungs. And also you have this through the enzymes and through aspiration, through swallowing. You have the cytokine can modulate bacterial adhesions of pathogens to the pulmonary epithelium. And studies have suggested that bacteria or bacterial products of oral origin are able to induce secretion of cytokines from pulmonary epithelial cells, which leads to the recruitment of inflammatory cells. And the inflammatory respiratory epithelium can turn or become more susceptible to infection due to epithelial inflammation. Some oral pathogens are able to stimulate epithelial cells to produce pro-inflammatory cytokines, similar to that degree observed for respiratory pathogens. So let's talk about further something called gut dysbiosis. So we have this, when we swallow, we can swallow and have bacteria go into our gut. This causes what we call a dysbiosis. Dysbiosis means it's an imbalance, gut imbalance. Everything right now is a very hot topic in healthcare. The gut bacteria, the gut health, be kind to your health, plant-based foods. So that is seen. Let me see. Sorry. And in health, oral microorganisms are poor colonizers of the GI tract. And there's a bacteria like P. gingivalis that could, once it gets into the stomach, it can actually live and continue to cause problems in the stomach and avoid the acidity of the stomach. All right, so then there's the endothelial dysfunction. Endothelium is basically the cells inside our blood vessels. Can also, they change during inflammation. And this is endothelial dysfunction is how atherosclerosis happens. So also this same pathway that we see through where how atherosclerosis happens, it's harder to dilate blood vessels and so things like, because it affects the nitric oxide of the endothelial cells, and which are what cause dilation. So this could be also another link, increasing the disease severity of and mortality rates in COVID patients, especially with diabetes, people who have hypertension and lung disease. So it just happens that people who have heart disease, diabetes, obesity, ironically, those are also the people that are dying. Those are those people have a lot of other issues that and this is one of the issues. Next thing, this is kind of again the overview, and you can see that kind of everything we talked about. We have bacteria from the gums. It can be aspirated. It can go into the bloodstream. It can cause the cascade or the cytokine storm, releasing CRP. Remember, that's C-reactive protein. That's not good either. IL-6 and a couple of others like TNF alpha and others. And directly link, again, that directly, IL-6 directly can cause respiratory complications. And then you have the indirect link through the blood vessels, through the gut, which indirectly challenges or harms the lungs, which the worst condition the lung is at the time people are in the hospital from COVID, the worst chance of them surviving. So treatment. Given the transmission rate of the virus and the 22 times higher risk for COVID respiratory complications linked to high IL-6 levels, we have to do everything that we can to decrease inflammation. This should be a priority. Also, periodontitis is considered a risk factor for cardiovascular disease, hypertension, diabetes. So these are also the people that have comorbidities. So we want to do whatever we can to keep their mouths clean right now. That's the main point. Now, people are, again, they're staying away from the dentist because they see charts like this on the news. But our job as dentists is to say, no. You have to come to our office now more than ever, and explain to them why. So I created an email that I will have available that you guys can send to your patients to basically let them know of this article that's been recently published, so they can look at it for themselves. At the end of the article, it's not so scientific. It goes solutions, general, overall, so I kind of break it down so even the general person could read it, the common person could read it. But we need to bring patients into our office more than ever. That's one of my missions and goals with this, is to inform the public and try to get people back into the dental office in a safe way, and indirectly, it's a win-win for everyone. Everyone gets help. So genetic testing is really important right now, and this is one of the I want to say solution, but it's one of the ways that you can check again to see your risk. There's a lab that we use that's very popular. It's called Oral DNA Lab. I called them. I spoke with the owner. He's a medical doctor. He gave me his data. He showed that of the samples that have been sent, of the 12,000 samples that have been sent to his office that have checked for IL-6 levels, again, IL-6 risk level, 45% of people had a GG, which is a high risk allele. 41% have a intermediate or medium risk, and 13.8% have a low risk. Again, these are people who have issues with their mouth, so we know that it's going to skew, and it's not as impactful of a data as a randomized controlled study. But in general, the GG serotype is found in 71% of severe periodontitis patients and 50% of moderate periodontitis patients. So there is a link, and it's good for people to know if they're high risk. Also for COVID, they have a higher chance of that cascade and their cytokine storm from going out of control. That's basically how to put it for their patients. This is the lab that report when you send it to the lab. They give you this report. It tells you which bacteria are in their mouth. It tells you interleukin-6, high, intermediate, or low. It talks about which part of their body are affected by the bacteria in their particular mouth. I do this with a lot of my patients during my consultations. We have it done before they see me, and it makes my consultation much more productive, easier. The chances that you can tell them whatever you want, but when they look at a piece of paper and it basically shows that they have, Tannerella forsythis, P. gingivalis, and that's connected and linked to a higher chance of, certain cancers, and it's also linked to higher chance of heart attacks and strokes, and also may be linked to diabetes. And so when people see it like this, they're gonna say, "Okay, doc, let's do whatever we need to get me healthy. I don't want this stuff. I don't want to deal with this stuff." So great tool. Again, this is the actual IL-6 genetic report. You can see it gives some information to the patient and whatnot. I don't want to get into that much, but let's talk about solutions, okay? So based on the scientific evidence provided in my article and on the guidelines from the ADA, we kind of came up with some solutions that we recommend for offices and dentists like yourself during these unprecedented times. We want to basically promote oral hygiene to decrease the burden of bacteria and screening for untreated periodontitis. Patients should be encouraged to brush their teeth twice per day for a minimum of 2 minutes and perform interproximal cleanings. So those little proxy brushes are good for people who have spaces between their teeth, but nothing's better than actual floss. And when they floss, you have to show them how to floss. They don't just go up and down, or else we have a papilla. So you literally want to go on one side of the papilla and then on the other side of the papilla. You don't want to go up and down and cut the papilla in half and cause bleeding that way. So they have to wrap around like the shining a shoe on one side, wrap around like the shining a shoe on the other side. And I'm big on water picks. I like to finish it off with a water pick. I recommend putting some either hydrogen peroxide inside the water pick, about 1/3 peroxide, 2/3 water. And I like it to be the last thing they do before they go to sleep, because during the time that they're sleeping, when their mouth is dry, is when it's best to have a film. It's like you're cleaning a car, and you want to not only wash it, you want to wax it at the end. You want to make sure things, if they fall down on it, they kind of just don't stick. So that peroxide film hanging out on the teeth protects the teeth the first couple of hours of sleep when the mouth is dry. I've been promoting that for many years. My patients who do it, I look in their mouth when I see them, and I'm like, yeah, you're doing that. Their gums and it's so tight, you can barely go underneath when you're probing. The gums just look so healthy. So also, we want to do a professional cleaning. Now, let's talk about cleanings for a second. I'm not talking about a prophy. This is not the time where you want to just polish. This is the time when you want to actually probe. You want to probe correctly. When you're probing, you want to get in there a little bit more. You want to angulate it a little bit more. It's okay. Your probe doesn't have to be straight up and down. You could angle it a little bit. Let's get in. Let's see where the middle part of the tooth is. Let's say you have this tooth. If you're probing like this, you're gonna miss the defect right in here in the middle. So angulate it a little bit more and see how deep. Sometimes you'll do that and you'll see you go in and blood comes out. This whole time for many years, this patient had something going on right here that was missed. Angulate it, see. Or distal of number 2 or 15. This is the back of the tooth. And again, we probe. But there's 3-rooted tooth. There's a furcation. There's a distal furcation. Angulate your probe. Get into that furcation. Because all of a sudden you'll see, whoa. That was maybe why they had some sinus issue, their ear hurting, the headache maybe. You have a cyst this big in between the roots. Remember, you have these 3 roots right here. This thing goes right in there. But when you probe like this, yeah, obviously you're not going to get it. You got to get in. So we have to be more on top of it now than ever on how to do a good comprehensive periodontal exam. When we clean, we cannot be afraid to numb. I go to many offices. I see the hygienists. You can either be nice to a patient and they love you because you're so gentle, or you can actually get the job done. This is a time where, you could be nice before, but right now you might want to numb in between number 14 and 15, between number 30 and 31, a couple of areas that are a little bit deeper, and
We seem to have lost connection with Dr. Molayem, so I will give him a couple of minutes to see if he can get back online. I think one of the most important things and takeaways here is that we definitely have to give a lot more emphasis on hygiene, and and really figure out a good solution here to get our hygienists back in the office, and really start promoting proactively prevention. I think, according to Dr. Molayem and some of the other tests, some of the other research that's out there, is that we should become a little bit more proactive about doing the saliva sampling and saliva testing. Dr. Molayem mentioned oral DNA as one of the companies, but I think that proactively taking saliva samples and sending this to for testing, and being able to see the composition of people's saliva, and some of these factors that may contribute to uh, respiratory issues. Maybe there might be actually a possibility now, because telemedicine is legally established and acceptable. We might be able to actually send these to our patients' home, charge them for the test, and be able to see if we can actually see the results. Even virtually, for those dentists who are not actively, going back to their offices, they might be able to actually see some of their patients through telemedicine. I think this fallacy that the oral health is not directly related to a lot of the issues that we're having systemically, is something that is really hurting our offices and hurting our patients as well. So I think it's more important now, more than ever, really, for dentists to educate themselves on the subject. I know that Dr. Molayem is actively promoting this at I think the California Dental Association, American Dental Association, have accepted this publishing and are disseminating it as well. And really look forward to seeing this research grow, and more people getting involved. And really now it's our turn to educate our patients, and to share this news. And I know that Dr. Molayem has offered, has created, his team have created some uh, materials that we can actually give to our patients and share it on social media. I think with that, I really want to, yeah, and we have some questions. Mr. Milan, we have you back? Okay, great. So I think one of the questions from our audience was, do we recommend laser bacterial reduction or laser assisted periotherapy with the cleanings? Um, I personally really proactively utilize lasers in my practices. I know my hygienists are using them regularly. I think that all of these, weapons that we have in our arsenal are things that we have to use now, from the saliva sampling to maybe even using some of the local antibiotics that we place inside the gingival crevices. The lasers are definitely something that are going to be important. I think we have many tools in our arsenal. So whether you do it remotely utilizing telemedicine, you do it on site directly in the office, I think that first is informing and educating the patients on what is going on and how important this is, and then creating protocols in our offices. Now, this is not only going to help our patients, this is also going to help our bottom line as well, and make sure that our offices stay productive. These are other revenue sources for our practices, and we can generate additional exams and and income from this as well, which is important for the livelihood. One of the major things that I'm concerned about, and it has been of great concern, is that a lot of the dental offices are starting to shut down. people have not been, attending the dentist and going to their dentist out of fear. And really a lot of good dental offices are shutting down. And I think long term this is going to be a huge issue, as a lot of great, amazing dentists who've been practicing for so many years are not going to be returning to work. And I think the patients need more access to care rather than less access. So we have to find ways to make sure that we maintain our offices and maintain continuity of care for our patients, and really make sure that our patients understand how important their oral health is, and really be able to give them more options as to how they can access the care. A lot of our patients are not able to come in. A lot of the most at-risk patients are at home right now and unable to actually come in to get treatment, whether it's out of fear or disabilities, or they're non-ambulatory. This is a good time where we can start adjusting. As I always like to say, history repeats itself. We used to make house calls. So some of those dentists and hygienists who are comfortable making house calls, who can come to the patient's house on site. There are various mobile companies now that are providing these services, and you can get involved and actually go on site and perform some of these cleanings on site. You can perform some of the testing on site. You can follow it up with telemedicine and teledentistry, virtual consults. A lot of the insurance companies are actually paying for these now, and really just right now, just start modifying the way we practice and start adjusting to this new information. And I would really be happy. We're going to share Dr. Molayem's information. We appreciate Dr. Molayem for taking the time on his weekend to join us. Thank you so much to the millions of viewers from around the world, from all the different countries, who continue to make this platform a huge success. And thank you for the Global Summit for another wonderful podcast, and looking forward to many more of these. So with that, I bid you adieu. Have a wonderful day. God bless, and we'll see you next time. Thank you.